Rahman. Welcome to Dr. HABIB Health Hub. This is Dr. HABIB Khan, and we will talk about the depression, causes of depression, their symptoms, and about the cause of depression. First of all, we can talk about the traumatic event that can happen in our daily lives, in our routine life, that we can suffer from a sudden event that will lead to a depression. Second is the overthinking that we make in our for our future, and the past event that we can do for our future, and the past event that will happen to us. These are the things, and we can't do anything about our past or the future things. Next thing is the smoking or drugs, any type of drug that you are taking in your daily life that will lead to the depression. And the fourth one is the family history that will lead to the depression, that your parents are not good, your family is not good. These are the things that will lead to the depression. And the fifth thing is the hypertension that will lead to the most of the depression. Okay, now we are going towards the symptoms. Symptoms are, first of all, we will feeling irritability, that we are not well-being, and we don't want to talk to anyone, we don't want to discuss it with anyone or anything with our parents, with our family, or with our well-being ones. Next thing is the insomnia, sleepless nights is the biggest symptoms of the depression. Sleepless nights, where we think about the future and the past. We will think about that, what to do in the future and what to overcome from the past. These are the things that we do when we can't sleep, and insomnia affects our aging, our mental health, and these are the things that led to the depression. The third thing is the weight loss. Weight loss is the biggest problem that we will have happen with us, that when we go to the depression, because our mental health is not working properly, our stomach is not working properly. That's why we can lead to the weight loss. And the number 4 is the mood swings. Mood swing, nobody talk about the mood swings, that when we get into the depression, there are a lot of mood swings. When you can't want to discuss your things to the elders or with your friends or families, because you can't want to discuss it, and you don't want to share about your internal feeling. That's why these mood swings are very important symptoms that will occur to you in the depression. Okay, next thing is the treatment. I will tell you about the treatment that we can do with the depression. There are two types of treatment of depression. Number 1 is pharmacological treatment, and number 2 is exercise. In pharmacological treatment, there are type of medicine that you take, and you can grow up from or get up from the depression. One, you can take benzodiazepines and SSRI. SSRI is the selective sorption reuptake inhibitor. Benzodiazepines are the ones that will help you to cure from the insomnia. SSRI will help you from getting up from the sadness or irritability or suicidal thoughts. These are the medicines like fluoxetines and fluoxetine, citalopram, and alprazolam, and clonazepam are the medicines that will take from nowhere to the everywhere for depression. And these are the best medicine that you would take and get out from this disease. And now we will talk about the exercises. I will give you the 2 bonus points that will give you that a boost, that will give you the comfort that you can grow up from this disease, and you can get a good to your best life. You can exercise in a simple room. You can do that in a unknown room. You can just sit and wait, and you can sit, and I will show you how you can do that. You can just breathe, inhale, and just 10 to 15 or 20 seconds you can inhale like this, and then exhale everything, and you are thinking about that with closed eyes, that you are sitting in the forest, and you are like here are oceans, or your best thing that you can visualize in your mind, and then you can exhale all your tensions from your mouth. This is the best way to get out from this. And the second thing is that you can go to gym and easily go for exercise or any sport. You can do that, and you can get out from this. Thank you. Get ready to elevate your well-being. Until next time, stay happy, stay safe, see you soon.